Diabetes isn't just a health challenge, it's a profound economic crisis impacting every facet of American society. With over 37 million people living with diabetes in the United States, the escalating costs of treatment are unsustainable. This deep dive will illuminate why diabetes has become America's most expensive disease, exploring its far-reaching implications for patients, healthcare systems, and the national economy, while also highlighting pathways toward a more affordable and equitable future. The financial burden of diabetes in the United States is staggering, exceeding $327 billion annually. This colossal sum encompasses direct medical costs and indirect costs from lost productivity, dwarfing expenditures on other major diseases like cancer and heart disease combined. Alarmingly, 1 out of every 4 healthcare dollars spent in the U.S. is directly attributable to diabetes care. This immense financial strain impacts federal and state budgets, particularly through Medicare and Medicaid programs, which bear a significant portion of diabetes-related expenses. For healthcare professionals, it signifies an overwhelming patient load and resource allocation challenges within clinics and hospitals. The general public experiences this burden through rising insurance premiums, increased out-of-pocket costs, and a less efficient healthcare system overall. Investors, meanwhile, recognize the vast market for innovative solutions, yet also the systemic hurdles to widespread adoption. The exorbitant cost of diabetes care in the U.S. stems from a complex interplay of factors, primarily prescription drug prices, frequent hospitalizations due to complications, and the lifelong nature of chronic care management. Understanding these drivers is crucial for developing effective interventions. At the forefront of the cost crisis is the price of prescription drugs, most notably insulin. A life-saving medication that costs mere dollars to manufacture can retail for hundreds of dollars per vial in the United States. This stark disparity is a global anomaly, with U.S. insulin prices significantly higher than in other developed nations. The intricate supply chain, involving pharmaceutical manufacturers, pharmacy benefit managers, PBMs, and insurers, contributes to this inflated pricing. Patent thickets and a lack of robust generic or biosimilar competition further limit market forces that could drive prices down. For patients, this often means rationing doses or foregoing essential medication, leading to severe health consequences and even death. Policymakers are grappling with legislative efforts to cap prices, promote biosimilar development, and explore drug importation. Healthcare professionals witness firsthand the devastating impact of non-adherence due to cost, while investors see opportunities in developing more affordable biosimilars and alternative drug delivery systems. Diabetes is a progressive disease, and uncontrolled blood sugar levels lead to a cascade of severe, costly complications. These include kidney failure, requiring dialysis or transplantation, lower limb amputations due to neuropathy and poor circulation, cardiovascular diseases like heart attacks and strokes, and vision loss from retinopathy. Each of these complications necessitates intensive medical interventions, often involving prolonged hospital stays, specialized surgeries, and ongoing rehabilitation. The cost of managing these advanced complications far outweighs the investment in preventative care and early disease management. Emergency room visits and hospitalizations for acute diabetic crises or severe complications represent a significant portion of the overall expenditure. This downstream cost approach is economically inefficient and devastating for patient quality of life. Healthcare systems are strained by the demand for specialized services, while policymakers seek to shift focus towards preventative strategies and robust chronic disease management programs. Unlike acute illnesses, diabetes is a chronic, lifelong condition requiring continuous management. This translates into ongoing expenses for regular doctor visits, specialized lab tests, continuous glucose monitoring supplies, and a variety of medications beyond insulin, such as oral hypoglycemics, blood pressure medications, and cholesterol-lowering drugs. The cumulative cost of these routine, yet essential services adds up significantly over a patient's lifetime. Effective chronic care also demands patient education, nutritional counseling, and regular foot and eye exams to prevent complications. While these preventative measures are cost-effective in the long run, they represent ongoing expenses that can be prohibitive for many. The healthcare system struggles to provide comprehensive, integrated care models that support patients holistically. For the general public, this means a constant financial drain, even with insurance. Investors are exploring models for remote patient monitoring and integrated care platforms that could streamline chronic disease management. While the financial figures are staggering, the true tragedy of diabetes in America lies in its profound human impact. These aren't just statistics. They represent millions of individuals and families facing immense hardship. Many Americans are forced to make impossible choices between paying for insulin and covering other basic necessities like food or rent. The heartbreaking reality of insulin rationing, where individuals deliberately take less than their prescribed dose to stretch their supply, often leads to severe health crises, emergency room visits, and even premature death. Families are driven into medical debt and bankruptcy, their financial stability shattered by the relentless costs of care. This isn't merely a medical problem, it's a deeply entrenched social and economic injustice that exacerbates health disparities and undermines the well-being of communities. Healthcare professionals bear witness to this struggle daily, while policymakers are increasingly pressured to address the ethical and humanitarian dimensions of healthcare access. Despite the daunting challenges, technological innovation in medical technology offers a powerful beacon of hope for transforming diabetes management. Continuous glucose monitors, CGMs, provide real-time blood sugar readings, empowering patients and their healthcare providers with actionable data. AI-powered insulin pumps and closed-loop systems, often referred to as artificial pancreases, automate insulin delivery, significantly improving glycemic control and reducing the burden of daily management. Beyond these advancements, startups and established companies are investing heavily in non-invasive glucose monitoring technologies, aiming to replace painful finger pricks and test strips with sensors that can read blood sugar through the skin or other novel methods. Telemedicine and digital health platforms are also expanding access to specialized care and education, particularly for those in remote areas. These innovations promise to enhance patient outcomes, reduce complications, and potentially lower long-term costs by preventing acute events. However, the high cost of these advanced technologies currently limits their accessibility, creating a new frontier for policy and investment to ensure equitable distribution. Addressing America's diabetes crisis requires a multi-pronged approach involving significant policy changes, a renewed focus on prevention, and collaborative partnerships across all sectors. The current trajectory is unsustainable, demanding urgent and decisive action. Policymakers have a critical role in enacting reforms that tackle the root causes of high costs. This includes legislative measures to regulate prescription drug prices, promote competition for essential medications like insulin, and streamline the approval process for biosimilars. Expanding access to affordable health insurance and strengthening coverage for diabetes, medications, and supplies are paramount. Furthermore, investing in public health initiatives that promote healthy lifestyles and early screening can significantly reduce the incidence and progression of type 2 diabetes. Consideration of value-based care models, where providers are incentivized for patient outcomes rather than volume of services, could also drive more efficient and effective diabetes management. International comparisons offer valuable insights into successful pricing and access strategies that could be adapted for the U.S. context. These policy shifts are essential to alleviate the financial burden on patients and the healthcare system alike. The most effective long-term strategy for reducing diabetes costs is to prevent the disease from developing or to intervene early to prevent complications. This requires a societal shift towards prioritizing public health and preventative care. Educational campaigns can raise awareness about risk factors for type 2 diabetes and promote healthy eating habits and regular physical activity. Community-based programs can provide accessible resources for weight management and diabetes prevention. For individuals already diagnosed, early and aggressive management of blood sugar, blood pressure, and cholesterol can significantly delay or prevent the onset of severe complications. This includes regular checkups, adherence to medication, and access to diabetes, self-management education and support, DSMES programs. Investing in these preventative measures yields substantial returns in both human health and economic savings. Healthcare professionals are key educators and facilitators in this preventative paradigm. Solving a problem of this magnitude requires collaboration among all stakeholders. Pharmaceutical companies, medical device manufacturers, and technology innovators must work towards developing more affordable and accessible solutions. Healthcare providers, insurers, and patient advocacy groups need to collaborate on integrated care models that prioritize patient well-being and cost-effectiveness. Investors can play a crucial role by funding research and development into novel treatments and preventative strategies, as well as supporting companies focused on affordability and equitable access. The general public must be empowered with knowledge and resources to take an active role in their health management. By fostering these partnerships, we can create a more resilient, equitable, and sustainable healthcare system for diabetes care. Diabetes is undeniably America's most expensive disease, a complex challenge woven into the fabric of our healthcare system and economy. Its costs are not merely financial, they are measured in human suffering, lost potential, and shattered lives. Yet, the future is not predetermined. Through concerted efforts in policy reform, a renewed commitment to prevention, and collaborative innovation, we can bend the cost curve and improve outcomes for millions. We urge policymakers to champion legislation that ensures affordable access to life-saving medications and promotes preventative care. We call upon healthcare professionals to continue their tireless work in patient education and advocacy, embracing new technologies and care models. We invite investors to recognize the immense opportunity in solutions that prioritize both innovation and affordability. And to the general public, we empower you to become informed advocates for your health and for systemic change. Let's work together to transform the landscape of diabetes care, ensuring that no American is forced to choose between their health and their financial stability. Share your thoughts on the biggest drivers of diabetes costs in the comments below, and subscribe for more insights into healthcare, business, and technology. Your engagement is vital to building a healthier future for all.